beautiful sunny day, my grandfather was a little restless. He went outside, sat under a huge oak tree. Later that day, he decided to run some errands. He went back inside to tell my grandmother he was going to Walmart to get their medications. An hour went by and my grandmother was a little nervous, but knowing he loved to talk, she wasn't too terribly concerned. However, when he had not returned home after a couple hours had passed, she notified our family. After an extensive search, we found him safe but terribly disoriented. He stated he was lost and could not remember his address or phone number to call. The one-time familiarly traveled ways that he'd known all his life were eerily different than what he had remembered. What is Alzheimer's disease? According to the Alzheimer's Association 2013, Alzheimer's disease is a type of dementia that affects behavior, memory, and thinking. The Alzheimer's disease literally deteriorates the brain. In this picture, you can see how different a normal brain is from an Alzheimer's brain. Alzheimer's disease has 7 main stages that are drugged along with the major signs and symptoms. Alzheimer's are still being researched, and prevention and the cure of the disease is very limited with hope for the future. The stages of Alzheimer's disease is very serious and should not be overlooked, and the statistics will shock you. There are 7 different stages of Alzheimer's disease. These stages range from mild to severe. Working in a nursing home, I have seen mostly all of these stages. Stage 1 is normal with little impairment. Very little is wrong with the individual's function of the body or memory. Stage 2 Alzheimer's does consist of individuals forgetting little words or the location of certain objects. Most individuals in their nursing home would meet stage 2. A few of the residents are considered as stage 3. Stage 3 would consist of having problems with saying the right words or remembering names. They also have problems performing relevant tasks. One resident in the nursing home is in stage 4. Stage 4 is forgetting recent events and forgetting the history. The resident does not remember eating although she just ate, but she does know certain names. After stage 4 is completed, the Alzheimer's disease starts to get really serious. Stage 5 patients have problems remembering their own address or even where they grew up. At this stage, the resident can use the bathroom themselves and eat themselves. Stage 6 of Alzheimer's is very serious. At stage 6, the individuals do not remember their name. They need help washing, eating, using the bathroom. They become lost. One of the residents is in stage 6 Alzheimer's. It's a scary disease with time taking over their bodies. The most critical stage is stage 7. In stage 7, the individual's swallowing is impaired and they have no support to hold their head up. These stages are dangerous and should not be overlooked. There are 4 main factors that cause Alzheimer's disease. Age is a main factor. Individuals 65 years of age or older is more likely to develop this disease. After 85 years old, the rate increases by 50%. The first chart is explaining the ratio of male to female 65 years or older. The second chart is explaining the rise in Alzheimer's disease with the increase in age. Family history and also genetics are linked to the disease. According to the Alzheimer's Association, the gene EE4 counts as 20 to 25% of Alzheimer's cases. Aside the family history, age, genetics, there's other factors that can possibly relate to this Alzheimer's disease. Head trauma along with vascular dementia is common factors that can cause it. As of this day, there is no cure for the Alzheimer's disease. There's medicine patches used to help the individuals as well as pills they can take. Also, the use of treatment and therapy will help the individual.